joining me for this presentation. I'd first like to do an acknowledgement of country. We acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, waters and culture. We pay our respects to their elders past, present and emerging. Hello everyone, my name is Lauren Day and I am the Future Workforce Program Officer with the Rural Workforce Agency Victoria, otherwise known as RWAV. The plan for this presentation is to give you a bit of an overview about who RWAV is and why we're relevant to students on the bonded medical program. I will also provide information about the old and new bonded medical program models and explain what it means for students on the old contract to switch to the new arrangement. The Rural Workforce Agency Victoria is a not-for-profit government-funded organisation that designs, delivers and creates sustainable health workforce programs and models that support rural, regional and Aboriginal communities. We work to attract, recruit and retain health professionals. Everything that we do is aimed at getting health professionals working in rural and regional Victoria because, as I'm sure you're all well aware, we are desperate for doctors, nurses and allied health professionals in these locations. I work in the future workforce space. I run programs and initiatives that introduce and encourage future health professionals to consider rural careers. I manage programs like the John Flynn Placement Program and provide support to bonded medical students where possible. How does RWAV support bonded medical students? In general, we try to facilitate opportunities for you to engage with health organisations and health professionals in rural Victoria. We provide participants with options and recruitment support for placement into rural roles that meet their return of service obligations. We offer clinical placement grants and Victorian Rural Health Conference grants, along with promotion and leadership grants. We also offer grants that give students the opportunity to attend health events, such as rural. We also offer grants that give students the opportunity to attend health events as rural ambassadors, along with rural experience day outs and Aboriginal cultural safety training. We work with the University Rural Health Schools by facilitating regular catch-ups that help us to share ideas and identify risks and challenges. We also engage with the rural health clubs to identify opportunities for collaboration. As the Future Workforce Program Officer, I try to ensure that all of these opportunities are accessible to bonded medical students and that bonded medical students are aware of them. Everything that we have available is promoted through our socials and on our website. So, how can RWAV support your future career? We recruit doctors for positions in rural and remote clinics around Victoria. We recruit fellow doctors for locum positions. We facilitate professional development opportunities. We administer the Health Workforce Scholarship Program. This program offers grants and bursaries to health professionals working in rural and remote locations to attend conferences or for further study. We provide bonded medical students with options and recruitment support for placement into rural roles that meet their return of service obligations. We can assist with information about professional development and support to enable participants to be part of broader rural medical professional networks. And we provide information about accessing rural medical experiences during undergraduate and early career years and access to grants. Let's look at the new bonded medical program. So all of the information that I'm presenting to you today can be found in the Department of Health Information booklet, which can be found on the department's website. Just jump onto Google and type in bonded medical program and you'll find all of the information that I've had access to in order to create this presentation. If you have any questions about this presentation that I miss, you'll be able to find the answers in these booklet or on these sites and all of those resources that are provided there. The bonded medical program, as I'm sure you're all aware, provides students a Commonwealth supported place at an Australian university in return for a commitment to work in eligible regional, rural and remote areas for a specified period once they have completed their medical degree. The return of service obligation refers to the time participants need to spend working in an eligible area as a medical professional in order to satisfy their agreement with the department. As of January 1st, 2020, new reforms have been introduced. These reforms better support bonded participants to fulfil their return of service obligations by allowing a longer period of time to complete the obligation. The new return of service obligation is 3 years. The option to complete 50% of the return of service obligation prior to fellowship and 50% post-fellowship is also available. Administration of the program has been simplified by moving from individual contract arrangements to a legislated program. And an interactive web-based portal has been introduced to support bonded students and doctors to better understand and manage their bonded obligations. Current participants of bonded programs will be able to choose whether they move across to the new arrangements or not. Participants who choose not to move to the new arrangements will keep their current contract arrangements. Bonded Medical Places Scheme participants who joined between 2016 and 2019 inclusively will be able to move across to the new scheme and retain their 12-month return of service obligations. And you can complete all 12 months prior to obtaining fellowship. I'm going to try to run you through some of the differences now between the new program and previous programs. Unlike previous programs, there is no individual contract or deed agreement. The participant agrees to participate in the program through the online portal. It's called MRBS, and this has been created for participants so that they can manage all of their obligations online. The return of service obligation is longer than some previous programs at 3 years. However, participants have 18 years from when they complete their medical course to complete the program, and they can complete up to 18 months prior to fellowship and then the remaining 18 months after fellowship. Fellowship is not compulsory. If you do not fellow after 12 years on the new program, you will then be required to complete any remaining return of service obligation that you may have. Unlike previous programs, participants will be able to manage return of service obligations through the online portal. Provisions providing increased flexibility regarding how participants meet their return of service obligation, including non-continuous, full or part-time and fly-in and fly-out work are available. There are no restrictions on the location or the work that participants undertake when they are not working to satisfy their return of service obligations during the 18-year period. Now, if participants are opting in from a previous program and have a 12-month return of service obligation, they have 18 years to complete it on the new program. However, they must work in employment which is full-time, at least 30 hours per week for a continuous period of at least 10 weeks at a time for it to count towards their return of service obligation. So the flexibility around how you can complete return of service that is available on the new program is not available if you only have a 12-month return of service obligation from a previous agreement. If a participant is on an old contract that has a return of service obligation of 6 years or longer, then opting into the new program will decrease that obligation to 3 years, and all of the new arrangement benefits and guidelines will apply. Eligibility. Participants are ineligible to opt in if they have already completed their return of service obligations, obviously, or if they are in breach of an existing contract or agreement. All other participants are eligible. Existing participants in the Medical Rural Bonded Scholarship or Bonded Medical Places Scheme can opt in at any time, and you can do so by emailing bros@health.gov.au. New bonded students will need to agree to participate in the program. Accepting a place and agreeing to participate in the program are actually two separate functions. To agree, log into the BROS portal. Now, this must be done by June 30th, 2020. Once participants have agreed, they will be able to download a signed, date-stamped version of their agreement. So, BROS is the name of the new online system that participants will be able to access to manage their program obligations. Functions of the system will be released throughout 2020, so it's really still sort of in the establishment phase. Health will use the information participants enter into their BROS record to send participants email notifications and reminders to assist in the management of program obligations. Participants are required to log into the BROS system every 6 months to confirm and update personal information. Eligible locations. I'll give you a rundown on the eligible locations now. Rural and remote locations are the only eligible locations that return of service obligations can be carried out in. You can access information about eligible locations through the mapping tool on BROS, or you can use the Dr. Connect website. During your intern years prior to fellowship, there are slightly less locations available to you compared with after specialisation. Now, there are 3 separate location definitions. The first one is the Monash modified model classification. This one is used to better distribute health workforce in rural and remote areas. It was developed to better target health workforce programs to attract health professionals to more remote and smaller communities. The Monash modified model is relevant to participants completing their return of service obligations pre-fellowship. During this time, return of service obligations can be completed in MM2 to 7 locations. The Distribution Priority Areas, DPA system, uses the best available data to identify those communities most in need of GP services. MM5 to 7 locations automatically deemed DPA. Inner metro areas, non-DPA due to vast range of services available. And the Northern Territory is automatically DPA due to the unique challenges in retaining health professionals there. And the final classification is the District of Workforce Shortage. This is an area where people have poor access to specialist medical practitioners. If an area's ratio of specialists to population is worse than national average, it will be considered a DWS classification. Inner metro locations are not included. DWS locations available to specialist medical practitioners only. The return of service obligations. We'll have a look at these now in detail. So the new program allows participants to complete their return of service obligations within 18 years of finishing their medical course or from the date opt-in occurs. If fellowship after 12 years is not obtained, any remaining return of service obligation can be completed on a continuous part-time, full-time, or on a per-day daily basis. If participants work full-time for the first 24 months of their return of service obligation in an MM4 to 7 location, they will receive a scaling benefit under the scaling rule. This means they could get a 6-month return of service obligation discount if they continue to work full-time in locations classified MM4 to 7. Now, if participants are opting into the program and retain their 12-month return of service from previous bonded medical places scheme, they must complete it within 18 years, but can only complete it, as I've said previously, over full-time hours and in consecutive 10-week periods, if not in one large block. So here is a list of what work will not contribute to the return of service obligations. So clinical research positions won't contribute, academic teaching positions do not contribute, medical, hospital or organisational administrative positions don't contribute, and paramedicine. So I want to go through a list of the frequently asked questions. I just want to let you know that this first one is in regards to the BROS helpline. Basically, you can send BROS an email, and if you have any further questions that are quite detailed, it can take quite some time for those questions to get answered. The department receives a huge number of emails and will try to respond as soon as possible. An immediate email will be sent to you advising you of their expected response time, and links to where you can find information such as the health website, where there are fact sheets on the program will be sent through to you, but it could take a while to get some information from them. So can you defer your bonded place? Yes, you can, but this is organised through your university and it is at their discretion whether you'll be guaranteed your bonded place upon your return. What if I change my mind and do not want to participate in the program? Should you not wish to participate, please contact your university and advise them that you will not be participating in the program. This means that you may lose your bonded Commonwealth supported place in medicine. What if I cannot complete my return of service obligation or change my mind and no longer want to participate after completing my medical course? You will be required to repay the cost of your bonded CDSP in the medical course, less a proportional amount for any return of service obligation you have completed. You can find the equation for that on the Department of Health's website under bonded medical places scheme, under the bonded medical program. So can I delay my return of service obligation during maternity leave, long service leave or annual leave? No. The answer is no. It has been considered that the total of 18 years to complete 3 years of return of service is quite generous, so they will not be offering any sort of delays to that. Now, can you get an extension on your return of service obligation? The 18-year period may be extended by approval of Health Secretary and only as a result of a medical condition that you or a family member of your family may have, which prevents you from completing your return of service obligation within the program's required 18-year period. And can I complete my return of service obligation working in an Aboriginal medical service? Yes, you certainly can. Just be aware that those services still need to be within an eligible location. So here are my contact details. So I've got my details there for myself as well as the Department of Health BROS team. Please feel free to contact